Good evening, everybody. I am thrilled that you're joining us for tonight, which is our first edition of what will be a monthly series of webinars. My name's Jim Derrick, and I am a co-founder and the director of family recovery here at the SAFE Coalition. By way of introduction, the SAFE Coalition is a nonprofit agency located here in Franklin, Massachusetts. We work throughout Massachusetts and indeed beyond the borders of Massachusetts, providing care to people that are impacted by substance use disorder and mental health concerns. We do that in a variety of ways. We do it through clinical care, we do it through collaborative care, we do it through providing adolescent wellness and prevention programming. And we also have a division that works in the harm reduction arena. Critically important, all of our services are free of charge to the public. We don't accept insurance. We don't accept any financial remuneration for any of our services. We are 100% grant and donor funded. And through tonight's webinar, you will be invited to give us a call. If any of you would like service, you can call us. I'll give our number right now. It's 508-488-8105. And you can reach us and expect a call back within 48 hours, and we'd be delighted to help you. Tonight, we are going to take a look at the disease of addiction, and we are going to talk a lot about the disease itself and the science behind the disease. And bringing that to us this evening is one of our staff members who is just a terrific addition to our staff, a recent addition, Kathryn Branca. And Kathryn is a licensed alcohol and drug counselor. She has over a decade of experience specializing in mental health and substance use, as well as trauma. Throughout Kathryn's career, she has led suicide prevention initiatives, partnered with law enforcement by co-responding to mental health emergencies, provided support after traumatic incidents to first responders, schools, and workplaces, and managed outpatient and residential treatment programs. She's passionate about building effective systems of care, utilizing holistic treatment options, and strengthening resiliency for individuals and communities. And I am absolutely delighted that she is with us tonight. And with that, I will turn the program over to Kathryn.
Thanks so much, Jim. Happy to be here. Welcome to everybody who is here live with us. I'm going to share my screen and we'll get started. Okay, so as Jim mentioned, today's topic is the disease of addiction and why science matters. I'm Kathryn and recently joined the SAFE team, so excited to be here. We do and have noticed and seen myself how much amazing work gets done here at SAFE, so excited to be here tonight with you. So Jim already ran through the SAFE Coalition, nonprofit organization, the contact information, AJ listed in the chat, but also wanted to be sure to share it here so that you know where we are, our phone number, our address, and then an email address as well if you need support. Due to the constraints of technology, we do want to share that if you need support at any time after this webinar, please feel free to reach us here at the office, at our website, or email us, and we will be happy and welcome anything that you may need help with. I wanted to highlight the SAFE Cafe as that's the main part of my work here at the SAFE Coalition. It's held every Friday, 8:30 a.m. to noon. And it's basically just an open house. So if there's anybody in need of companionship, conversation, services, support, if you have questions, you just want to hang out, have a nice warm cup of coffee. It's, going to be winter here, so getting a little cold here. We welcome you to come on Fridays and just hang out with us and chat. An overview of our agenda here. We're going to start off with some housekeeping, learning objectives today. We're going to define addiction, go through the brain's reward system, and how addiction takes over that system, run through the brain and body effects of addiction, as well as the science and path to recovery, review some case studies, and then answer any questions that might have come up. Some housekeeping things. You can see here my little Mrs. Doubtfire video probably shows that I'm an older millennial here, but that's okay. So I just want to invite you to give yourself the gift of being present. In our world, we're pulled in a lot of different directions. We all wear a lot of hats, and just giving yourself the gift of being here with us for the next hour and taking this information and really just ending here with us on a positive note, and that recovery is possible. We always ask that you please be respectful in the chat and with any questions that you have. And just remember confidentiality. If you know somebody who's asked a question, or if something comes up that's somebody brings up, we just ask that you keep it here, anything that is said here. Always like to remind people that addiction is a difficult topic. Most of us have been touched by this personally, professionally. Either we struggle with it ourselves or a loved one does. If you need a break, please take it, but please come back, because as I mentioned, ultimately this is a story of hope and recovery is possible. We want to make sure that you come back and get that information too. Questions. If you have any questions that come up, we are going to reserve time at the end to be sure to answer those. Please feel free to put them in the Q&A feature, which should be on the bottom of your webinar screen. You can also put them in the chat. It would just be super helpful for us to manage, because sometimes the chat can get a little bit busy. So please feel free to share them in the Q&A, but if they come through in the chat too, of course, we'll try and get them there. Closed captioning, there is an option for you as well, should be on the bottom of your webinar screen, to start closed captions if that's something that would be helpful for you. And last on the housekeeping list, the next webinar as part of the series that SAFE is doing, we're going to be running webinars at the last Thursday of each month outside of the holidays. The next one in December will be from 6:30 to 7:30, so it's the same time period. And this will be on the symptoms of addiction. So I see here that AJ put the webinar link in the chat so that you can register for the next one and see more information about the ones that we have coming up. So learning objectives, this is what we hope and would like you to get out of today's hour. First being understanding addiction as a brain-based disease, what that means, learning how it affects the brain and the body, recognizing that recovery is supported by neuroscience, and then learning practical ways to apply all the science that we talk through to recovery. So first off, what is addiction? We're going to kind of bring it back to the basics. When we say addiction, what does that actually mean on a scientific level? So AJ, if you want to do the first poll, please. Which statement best reflects your view of addiction before today's webinar? There's no wrong answers. This is totally a judgment-free zone. We just want to see where people are at with this question, what you think. All right, thank you, AJ. So it looks like the majority of you answered the first option, a treatable chronic medical disease, and then we also had a mix of both as an answer. So we are going to address this right here. As most of you said, addiction is a treatable chronic medical disease, involves interactions among brain circuits, genetics, the environment, and an individual's life experience. So that's the formal definition. Obviously, there, as you can see here, are many things that play into why somebody may ending up struggling with addiction. Just as a kind of story from my own professional work, one of the first jobs I had out of grad school was working at the state women's prison in Massachusetts. And a lot of women who were there struggled with addiction before they came into the prison. And I will say that the majority of them struggled with a history of trauma, neglect, or abuse in their past. So these are all things that can really play a role into why somebody may ending up struggling with addiction. So people with addiction, they use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. So this is kind of something that I know I've heard throughout my work is, why do people keep using even though it hurts them so much? You know, it's can be hard to really understand what is making somebody create such difficulty in their own life over a substance, right? So, we're gonna learn exactly why that happens coming up and what we can do about it. Why this is a hopeful message is that prevention efforts and treatment approaches for addictions are just as successful as those for other chronic diseases. So things like cardiovascular disease, type 2 diabetes, we have treatment and prevention approaches for those, and we also have them for recovery and addiction. So it's the same thing here. So we're going to watch a video on the next slide here. It illustrates the science behind addiction and this disease versus choice perspective. As I'm sure, and we kind of talked about it and you saw it in the poll, there historically was this belief that people who struggle with addiction, it was a choice they made because they had a lack of willpower, a deficit in their character. That meant that, you know, they were kind of just struggling with addiction because they couldn't handle their own kind of willpower issues. What we now understand, and is very clear because of brain science, is that that's not the case. These drugs hijack really important regions of our brain, causing changes that lead to this chronic use, the more intense use, and more antisocial kind of behaviors around the use as well. So this picture here on the right just kind of shows different brain regions that I'm kind of thinking back to like my 7th grade biology. And it's a good reminder of the different areas of the brain and kind of how they play into this addiction piece of it as well. So we'll talk about that in the video. But I just want to invite you to kind of think through, and maybe after in the chat or during the video, you could share some things that stand out to you while you're watching.
Addiction is defined as not having control over doing, taking, using something to the point where it could be harmful to you. Previous to understanding the science, it was thought that addiction resulted from a lack of willpower and was a moral failing. But we now know that addiction is a physiological disease. It changes the brain structure in ways that can alter the way it works and process information. To understand how that happens, we start by thinking about reward and the brain's natural reward system. The reward pathway's primary function is to reinforce sets of behaviors. Evolutionarily, it began as a way to indicate to us that actions that help us survive are good and we should keep doing them. This is mediated through a chemical called dopamine. Following an appropriate behavior, the reward pathway releases a small burst of dopamine. That burst of dopamine is a satisfying jolt, encouraging you to repeat the same action in the future. Dopamine will in turn also act on areas responsible for memory and movement, which helps us automatically build up memories for what is good for survival. The problem is that addictive substances hijack our natural reward system. Every substance has slightly different actions on the brain, but one thing all addictive drugs have in common is that they produce a pleasurable surge of dopamine. Addictive drugs all cause dopamine to flood the reward pathway 10 times higher than a natural reward would. Over chronic use, nothing else natural is quite as rewarding. In fact, as substance use increases, the circuits adapt and reduce their sensitivity to dopamine, a phenomenon known as tolerance. For example, let's say a person takes cocaine for the first time. The reward system receives a huge burst of dopamine. But as the person takes more frequently, cocaine will be overstimulating the brain with dopamine. This will cause the brain to adapt to these chronically high levels of dopamine. To compensate and adapt to this new normal, the brain reduces the number of dopamine receptors available in the reward system and releases less dopamine. As a result, that person will feel the need to increase the amount of drug they take so that they can reach the level of high that they're used to. But it's not just the reward system that's affected by this tolerance, since dopamine is also involved in other brain mechanisms. Other brain regions involving decision-making, memory, and judgment also get physically disrupted as a result. The overall effect is to have drug-seeking behavior driven by habit rather than conscious thought, like a reflex instead of a choice. This biological basis helps to explain why addiction really is a brain disease, not a matter of willpower. The stigma that accompanies addiction only makes seeking treatment more difficult.
Okay, anything stand out to you while watching this that you wanted to share in the chat?
Addiction
Okay, well, if anything comes through in a few minutes, obviously feel free to share it anytime through the chat. So just as a recap of what the video talked about, addiction is not a matter of weak willpower or bad choices. It changes the way that the brain functions and its actual structure. Oh, okay, I do see here somebody says that their chat is disabled. Okay, thanks so much, Mary, for letting us know. So I won't try and ask for anything else in the chat. Thank you. So neural circuits that are tied to reward, motivation, and learning, self-control, these are all altered while somebody is using substances. So dopamine, the important neurotransmitter mentioned in the video, the brain evolved these reward pathways to reinforce survival behaviors. So like there was a kind of cartoon image of somebody holding a bow and arrow, and then they were eating like the giant chicken turkey or whatever at the end of it. So hunting equals I'm able to eat. So that dopamine pathway gets rewarded over and over, and these behaviors kind of get reinforced as a survival mechanism. The problem with addictive substances is they hijack these circuits. They give us such high levels of dopamine, far above what like a natural, normal reward would be, that creates this addiction, this level of addiction, right? So the brain adapts over time to the substance, and over time, more and more is needed in order to achieve that same original effect that the drug originally gave the person, which is called tolerance, right? So you can think about somebody, maybe at first they drank 2 beers at night, and that suddenly went up to 3, went up to 4, and the 4 beers is what it takes to equal the 2 that originally caused that relief. So the baseline sensitivity to that reward or that relief is reduced over time when somebody is struggling with addiction. So this shift from voluntarily being able to use to compulsive behavior, the substance seeking becomes habitual and less a matter of like the person consciously choosing to do this. So that kind of helps us explain why these behaviors that aren't so great may be happening when somebody's struggling with addiction. Like I know in my professional life, I've worked with people who end up having DCF involvement because of substance use in the home. And people will say like, well, why don't they just stop? And it's like, it's not that easy, right? There's these pathways in the brain that have been taken over and they're no longer making these conscious decisions about their drug use. So these functions like memory, decision-making, and judgment are all impaired with this repeated use. Stigma is a huge barrier. My experience is that this has gotten a little bit better, but it definitely still exists. Language is a really important piece of this. So the way that we talk about people struggling with addiction matters. Junkie or clean can really exacerbate some shame around somebody struggling and needing help and make it harder for people to seek that help. Clean is not necessarily the best word to use because it has like when you think about what's the opposite, dirty. So if somebody's using, are we considering them quote unquote dirty? Of course not. So this piece around language, I think, can be really important. I also personally just don't call somebody an addict anymore. I say somebody is struggling with addiction because we're not labeling them forever unless they choose to and talk about themselves that way. That's totally their choice. Just if, as somebody who works with somebody struggling with addiction, that's the way that I would say it. There is this misconception, and again, I think this has gotten a little bit better, but that recovery must exclude medication. We're going to talk about this in a little bit, what exactly medication-assisted treatment can look like, but medication-assisted treatment is evidence-based and often an essential piece of recovery for a lot of people struggling with addiction. Treatment is a combined approach, and that's when it's the most effective, right? Is when we combine medication when appropriate with counseling and behavioral services and all kinds of other supports that we're going to talk about later on too. And as we mentioned, addiction can be compared to chronic diseases like diabetes. It's treatable, but like a diabetic takes insulin, addiction also takes ongoing management. So this little chart here on the right just kind of puts together everything we've been talking about so far. The key brain areas like the prefrontal cortex, the hippocampus, the amygdala, these are all pieces of the brain that are affected by ongoing drug use. So the reward system is a brain network that regulates this pleasure reinforcement, encouraging behaviors that promote our well-being. Substances hijack this, leading to this compulsive drug-seeking behavior. I wanted to talk through how substances affect the body, because when we talk about the disease of addiction, just like if we're talking about another disease like type 2 diabetes, it's affecting our bodies in different ways. I think it's important to recognize this as a piece of how addiction is really hijacking the brain, but also the body ultimately. I chose alcohol and opioids. Of course, there are other drugs like cocaine, crack cocaine, methamphetamine. These are the two that I see most often in my work, is alcohol and opioids. So I thought this would be a good place to start. As far as the effects on the brain and central nervous system, alcohol greatly increases the risk of stroke, dementia, neuropathy. It can also, withdrawal can lead to what are called delirium tremens, DTs. This is a really extreme form of withdrawal for somebody who's been struggling and drinking heavily for a long time. It really has to be a medically managed detox because it can cause hallucinations, confusion, and seizures. Opioids can cause cognitive deficit, stroke, neuropathy as well, nerve and muscle disorders. Alcohol, as far as how it affects our cardiovascular system, high blood pressure, cardiac arrest, coronary artery disease, and opioids can cause heart-related infections due to bacteria entering the bloodstream. These are all things that happen over time, right? So when we're talking about addiction, we are talking about somebody who is struggling with long-term chronic use. So that is where this piece of it would come in, and these effects would happen. Alcohol affects the respiratory system. Lung collapse can worsen sleep disordered breathing, so like sleep apnea issues can make worse. As far as opioids, it can cause respiratory depression, meaning like the lungs stop, permanent brain damage, coma, and ultimately death as well. For alcohol, it can affect our kidneys, the renal system. It can really affect our fluid balance, right? Because we know it can be dehydrating, and that can create improper imbalances within our fluids in the body, can lead to kidney issues due to liver disease as well. Opioids can cause acute kidney injury. It can break down muscle tissue that releases damaging proteins into the bloodstreams, which of course ultimately affects the kidneys. The reproductive system can also be affected, so lower semen quality and hormones in men, and also cause irregular cycles and ovulatory issues in women. Opioids can cause infertility, erectile dysfunction. Also, they increase the risk of adverse health outcomes for infants and mothers. Alcohol can lead to a host of different cancers, breast cancer, liver, head, neck, etc. And then for opioids, research here is a little bit contradictory. Some opioids seem to inhibit the growth of cancer cells, while others increase them. And just wanted to make a kind of a special note on IV drug use. So for things like opioids or cocaine, crack cocaine that some people are injecting, there are unique risks to this. So of course we know overdose is a major risk here, abscesses and bloodborne diseases like HIV, AIDS, and hepatitis C from sharing needles. So now that we've kind of run through what addiction is, how it affects the body, how it hijacks the brain, the important role of dopamine, and how chronic use can lead to this pathway being taken over, I wanted to bring some hope into the conversation. Neuroplasticity is a really cool and really crucial part of the path to recovery. So neuroplasticity is the brain's ability to reorganize and form new connections. So basically just rewiring the brain. So that reward pathway that was kind of wired for chronic substance use, we can rewire it for recovery, which is amazing and fantastic. And we can really kind of use this to our advantage. So new habits create new neural pathways, and we're going to talk through exactly what this looks like. We're going to go over some case studies and really show how we can put this neuroplasticity into action. The important pieces for neuroplasticity is consistency, repetition, and environment. I heard from somebody I worked with who is in recovery that every single day they had to wake up and choose to be sober. It was a choice every day, right? And that may intimidate some people or it may motivate others. For him, it was really helpful for him because he kind of had the power and was empowered to make that choice every day but it also reinforced that consistency, repetition, and his environment that created this neuroplasticity for him. So neuroplasticity and creating these new pathways, it's really important that sleep, nutrition, exercise, and mindfulness are present for neurogenesis, which is the creation of new neurons. So on top of neuroplasticity, there's, of course, many other evidence-based recovery supports that we use to help those struggling with addiction. The main ones are listed here. So we have cognitive behavioral therapy. You may have heard of CBT. CBT is a therapeutic approach that people look at and develop insight into their thoughts, behaviors, and emotions, how they relate to each other, and how they influence each other. Medication-assisted treatment, like I mentioned before. So there are different medications available. You may have heard of methadone, Suboxone, naltrexone, Vivitrol. These are all different medications that interact with the opioid receptors in our brain. And some of them block them completely, some of them like partially interact with them. People who are struggling with substances would take this medication, and methadone, for example, is taken every day. You may have heard of like a methadone clinic. So somebody goes every morning, takes their methadone dose, and then these medications, they both help with the symptoms of any withdrawal that may have happened if they weren't going to get their dose. But they're also not getting high from them. I mean, this is a key piece of it, right? I think this is kind of a misconception around methadone or Suboxone. When somebody's on the proper dose of their medication-assisted treatment option, they're not getting high from that dose. So it is and can be a really amazing therapeutic tool for somebody to be able to go out and live the life that they want while being supported medically, right? So mindfulness and meditation practices can also be really, really helpful for recovery. And mindfulness maybe sometimes gets a bad rap, or maybe just can seem a little intimidating because it's like, I just have to sit quietly and meditate and just like not think about anything. And I get that, right? That can be kind of an intimidating thing. But it doesn't have to be like sitting quietly and just trying not to think about anything and clearing your mind. Mindfulness can be like cooking or taking your dog for a walk or spending time in nature, deep breathing. One of my favorite tools is something called box breathing, box, B-O-X, where you inhale for a set number of seconds, hold your breath for a set number of seconds, exhale for a set number of seconds, and then hold for a set number of seconds. So I just wanted to kind of demonstrate it real quick here for you, but you can use it anytime, like anytime you're anxious or in a situation where you just feel like you need a minute, but you can also practice it more formally, like 2 minutes in the morning, you just sit and you breathe. So you would inhale for 4 seconds. So 4, 3, 2, 1. Hold for 4 seconds. 4, 3, 2, 1. Exhale for 4, 3, 2, 1. Hold 4, 3, 2, 1. And then you would start over. Or you can just do it once. And that really kind of helps to recenter, kind of calm your nervous system. And it can be a super helpful tool for people in recovery, maybe struggling with cravings or impulsivity, to just kind of calm down, recenter, and get back to kind of refocusing on their recovery. So that can be a part of mindfulness too. It doesn't just have to be the meditation piece. Also wanted to mention the importance of social connection, supportive environments. I'm sure we've all heard of things like AA, Alcoholics Anonymous, Narcotics Anonymous, NA. The power of those is that it's the social connection piece, right? People don't feel so alone in their addiction and their struggles. So AJ, if you want to come or run the next poll, please. Which part of the brain science behind addiction surprised you the most? Awesome. Thank you so much, AJ. So looks like the biggest answer, the role of neuroplasticity in recovery. Yeah, I think that's a really cool piece of this, right? We can kind of use our own biology to our advantage here when we speak about helping those with addiction. But then also we had some people answer how the stigma affects treatment, how addiction changes decision-making and control, and then the dopamine reward pathway we talked about. So thank you so much for answering those. Okay, so how do we put all the things we're talking about here into practice? Lifestyle medicine is a medical approach to treating and preventing chronic disease like cardiovascular disease, type 2 diabetes, but also, like we now know, the disease of addiction. We can also apply it here. So lifestyle medicine has 6 different pillars: movement, nutrition, sleep, stress management, build supportive relationships, and avoid harmful substances. I broke this down into simple habits that every day somebody struggling with addiction could implement one of these, and then we can see how exactly doing that one little thing affects the brain and that neuroplasticity piece to our advantage, right? So say somebody was like, okay, I'm gonna walk every day. Well, why does that matter? Like, why would that be helpful for somebody in recovery? Because it helps the brain rewire those dopamine pathways and boost somebody's mood, especially if they're outside getting some sunlight. I know here it's in Massachusetts, it's cold, but sometimes it can be nice to bundle up and take a walk, right? So nutrition, choosing whole foods, or even maybe just cooking a meal at home that you want to try out a new recipe, right? You can kind of bring in that mindfulness piece, but you're also preparing your own food, and that's supporting your gut and your brain health. Sleep, I feel like we could have a whole webinar on sleep and the importance of it. Consistently having a good sleep routine, I mean, restores emotional stability is one thing, but so many other things, right? Like we all know the effects of waking up from a terrible night of sleep and how that can affect us the rest of the day. So stress management, we talked about using breath work, mindfulness. As I mentioned, this can really reduce cravings and any impulsivity because you're creating space between what you think and how you react. You're kind of building that muscle of that pause. Building supportive relationships, joining safe, non-judgmental groups. This strengthens resiliency and reduces loneliness, right? We know loneliness is a huge trigger for relapse. And then finally, of course, avoiding harmful substances, limiting alcohol, drugs, and nicotine. But why is that so important? It's because it prevents reactivating those addiction pathways that we talked about earlier. So the last poll here, which lifestyle medicine pillar do you think would be the easiest for most people in recovery to start with? Thank you, AJ. There's no right answers here. Just wanted you to have a minute to kind of reflect on this piece. Awesome. Thank you. Yeah, I think movement, right? That makes a lot of sense to me. And then building supportive relationships. I know that one thing that the recovery community does really well is the supportive relationships piece. I think we have a lot of support groups for both people in recovery, but also family recovery. Jim, who is here on this webinar with us, is really big in the family recovery space. So yeah, there's no right answer here on what would be easiest or what somebody may choose to start with, but I think movement, building supportive relationships, that makes a lot of sense. Okay, so we have a case study here. This comes from, it's de-identified, right? Meaning like this person's name has been changed, but it comes from kind of an amalgamation of different people I worked with throughout my career. I've done a lot of work with first responders, so it's something that is near and dear to my heart. And of course, we know addiction touches that community as well. So Jordan was somebody who struggled with alcohol misuse for nearly a decade, 38 years old, being a paramedic, long shifts, poor sleep, chronic stress. He had a health scare and some pressure from his family, so decided to go into treatment. While that helped with the kind of physical dependence of the drug, it didn't so much help with the emotional side of things. So he felt flat, really afraid of relapsing, didn't feel like he had the tools to avoid it, and unmotivated. So we implemented a recovery plan built around the lifestyle medicine that we just talked about. So the first pillar, we talked about movement. He started walking outside when he could for 15 to 30 minutes, joined a hiking group, which kind of mixes a couple different things, right? The hiking group is both building positive connections, but it's also movement, and it's mindfulness too. So noticed a change in 3 weeks with fewer cravings, improved mood, but also this piece I think is really key. The hiking replaced his former drinking time. And that can be difficult for people to kind of be in treatment, but then when they leave treatment, they have this time that they used to spend using substances or hanging out with people that weren't great for their recovery. And they're like, what do I do now? So having some of these tools in place as part of like a discharge plan when somebody is leaving treatment can be really helpful. Nutrition, like we talked about, focusing more on this whole food-based meals, but also like what worked for him practically going to work. Rotisserie chickens, protein shakes, making overnight oats. So all different kind of pieces went into the nutrition side of things. Sleep and being a first responder don't always go hand in hand. So we did what we could here. And this goes for everybody and every piece of this, right? Like do what you can within the capacity that you have. Like do your best, right? Being a first responder, disrupted sleep is always going to be the case. So reducing screen time at night, 1 cup of coffee per day, like these little tweaks really supported a sleep structure that benefited his recovery. Stress management, we talked about this piece, so implementing 10 minutes of breathing, but also journaling really helped calm down before cravings escalated. And also self-compassion, like so many people who struggle with addiction are so down on themselves. And if we can build this sense of compassion for themselves, that's going to make them or help them want to practice these skills and stay long-term in recovery when they have a better sense of self-worth. So he also joined a local AA meeting and reconnected with his family. This helped reduce loneliness, gave him accountability and encouragement. The last piece of it, avoiding harmful substances. So this also included like energy drinks. I know sometimes we rely on like those Red Bulls and that extra cup of coffee at 3 o'clock to get us through. While totally understandable, that can be a little tricky in recovery because it can be a stimulating experience. and we want to stabilize the energy and the mood and reinforce that sobriety. So putting all these pieces together, wasn't an overnight thing, right? Like we're talking about doing things every day, really committing. And after 6 months of sobriety, both his physician and his family and himself, they all noticed more stable mood, more confidence in himself, less overwhelm. So I did have another video, but I know we wanted to leave time for questions. So should we open it up for questions and we could share maybe the video in the chat and people can watch it on their own? Great. So I'll just put the link in the chat when I exit here. So just wanted to quickly go over some takeaways, and then I'll turn it over to AJ to facilitate and begin the Q&A process. So science matters when we talk about addiction. It's a treatable disease, it's a brain disease, it's not a moral failing. It responds to the right mix of care, including medical, psychological, and lifestyle. Neuroplasticity plays a really important role in this, as we can rewire our brain through new habits, supportive environments, and consistent routines. The lifestyle medicine pillars that we talked about, movement, nutrition, sleep, stress management, connection, avoiding harmful substances, these all strengthen recovery because they support the brain and body's natural repair system. Stigma creates barriers, so using respectful language and empathy can really make a difference in people seeking treatment and help. And then finally, recovery is not just avoiding a substance, it's creating a life that is more rewarding, it's more connected, and more meaningful than anything that addiction ever gave them. So just wanted to end on that note, and I'll open it up for questions.
Thank you so much, Kathryn. We do have a question about the medicine-assisted treatment. Will the person have to stay on that for the rest of their life, or is there a certain time frame for it?
Yeah, that's a decision that they would make with their doctor. A lot of people do spend a majority of their life taking medication-assisted treatment. So like methadone, for example, like I mentioned, it's something that you have to go to the clinic every day and get your dose. Eventually, there are ways for people to take home their dose of methadone, but that's after, they've kind of worked with their treatment team and established some boundaries around that, because methadone is an opioid. So it's very carefully regulated federally. That would be a decision that they would make after speaking with their care team and their treatment team around eventually being able to take home that medication. That's just methadone as one example. But yeah, so people do end up staying on these treatments for a long period of time, and ultimately it can be lifelong or not, depending on how they feel about tapering off or stopping. And thank you for the question.
Yes, and here's one about neuroplasticity. It's a fun word to say. How long will it take for the brain to return to normal after stopping use?
Yeah, I think like we talked about in the case study, 6 months is a good target date. There's no hard and fast rule to we can't necessarily, unfortunately, look in somebody's brain and see these new pathways created. But I think 6 months, a year, it really depends on the consistency, the repetition, and the environment that somebody's in, if they're able to kind of repeatedly do these behaviors that we talked about and make it a lifestyle. And then over time, these new habits become their lifestyle. So yeah, I think 6 months to a year, but there's no hard and fast rule.
And then a related question to that, if someone does relapse, does their brain chemistry immediately change back to those heightened tolerance, or does that take time? What happens there?
Yeah, relapse can be scary because that tolerance, depending on how long somebody's been sober, really can lower. So yeah, if somebody has relapsed and so the question was like, do they immediately go back to these addiction pathways, like restarting? That was the question, right?
Sorry, I just moved the question.
No, it's okay.
Does the brain chemistry immediately change, or can they still quit more easily if they don't continue to use?
Yeah, it depends on it's very individual, like depending on the drug they were using, depending on their environment. Yeah, these things it's just kind of a case by case. So I hate to say it depends, but unfortunately, somebody can relapse and not continue using. They just relapse or use that one time. And there are other people who they use one more time and then they're back into that addiction full force.
A few more questions about medication. Can you explain the difference between Suboxone and the new shot that's being given?
Yeah, so what I'm understanding from this question, Suboxone is an opioid. It's like a little film strip that people would take every day, like methadone. As I said, they kind of can either have it um, like they take it every day. The difference between something like a Suboxone that you're taking every day and a shot, so there's something called Vivitrol, like for alcohol use, that would be a monthly injection. So most of the opioid use disorder treatments are something that has to be taken every day because the opioid receptors in the brain like need that daily attention. And then something like Vivitrol, because of the way it intersects with the opioid receptor in the brain, that can be a monthly injection. I mean, I'm not a physician, so this is just speaking as somebody who understands kind of the basic physiology of how they interact with the opioid receptor. And the Suboxone would be a daily thing because of how it interacts with the opioid receptor. And then the Vivitrol, the shot, would be monthly because of how it interacts with the opioid receptor.
And this one here, is there a preferred test to examine the damage that has been done to the brain from years of substance use?
So I don't know that there's a test, like a medical test per se. Um, this is just something that has been like elucidated from the research where we understand how opioids, how alcohol affect the brain's pathways. And because we understand this dopamine surge and this like how it affects our long-term use and how it affects our tolerance, like all of these pieces kind of play into how we understand these changes are happening. So there's not a test per se, at least in my experience.
And then here, could you say a little about post-acute withdrawal, and the time it takes for the brain to rewire before you can experience normal levels of dopamine from pleasurable experiences again?
Yeah, so post-acute withdrawal, also called pause, it's a syndrome. And for people who are newly detoxed from a substance, so they're like they had been using for a long time, they enter detox, they withdraw from the substance. There are different like symptoms that can happen when they're freshly detoxed. So things like irritability, anxiety, cravings, drug dreams, these are all symptoms of kind of that post-acute withdrawal time period. The question around, sorry, I'm just trying to see what exactly. Okay, so the time it takes for the brain to rewire before they can experience normal levels. This goes back to like that kind of 6 months to a year. Everybody's going to be different. It depends on somebody's physiology. It depends on their treatment plan. It depends on like what they're doing for their recovery. But recovery and experiencing like pleasurable experiences again is possible. I just don't know that there's a set, like, you can expect this in 2 weeks kind of a thing.
I have a few more in my queue, but Jim, do you have any questions you'd like to hop in?
Well, actually, I have a comment. Thanks, AJ. And I just wanted to, first of all, thank everybody for attending tonight. If you're here because somebody you know or love is struggling with addiction, I just want you to know how essential family recovery is. And I was really struck during Kathryn's presentation about how many of the recovery principles, in fact, all of the recovery principles other than medication-assisted treatment, apply to families too. We know that the trauma of experiencing a loved one go through the process of addiction, substance use disorder, impacts the entire family. It really throws the family balance out of whack. And so we now know that we treat the entire family, not just the individual. That's the most effective way to uh, to cope with and to treat what truly is a family illness. So I just want to encourage people to reach out and reach out to me directly, Jay Derrick at safecoalitionma.org, or you can call our support line if you'd like to talk more about family recovery. And also, I just want to let folks know that recovery, as Kathryn has said many, many times, does happen and happens often. This is a disease that uh, is something that happily does have many, many stories of great recovery. So I just want to encourage people along those lines. Thanks, AJ.
And I think that's a good transition to I have two questions kind of thinking about the family dynamic, the loved one dynamic of support. So one, just in terms of trying to understand, if we have this understanding of addiction, why won't my loved one stop using substances?
I'm happy to talk a little bit, but Jim, I'm open to
Yeah.
whatever.
Well, I think without a doubt that is the difficult challenge of being a family member is trying to wrap your head around, and I have lived experience around this, to be fully transparent. The way that I get into this business is through having a son that was struggling with substance misuse. And so I remember those sleepless nights and mornings waking up, pulling my hair out, just saying, why won't they stop? This doesn't make any sense to me. And this is why I think this presentation was so important, because science does matter. It makes no sense as a layperson or as a family member watching somebody seemingly make a choice every day. But once I know underlying that choice, the brain chemistry, I'm more empowered to meet them where they're at with more empathy and understanding. Uh, so it's difficult. And like I said, I think family support is critical in this entire process of recovery.
And then that was the follow-up question there, that they went hand in hand. So then how do I best support my loved one at home and help them prevent relapse?
Yeah. Well, I can tell you the National Institute of Health came out with a study just a couple of years ago that said that families that did receive support and got into their own recovery were much better prepared to support that individual. So I think the first step is education. The second step would actually be reaching out and getting your own support, whether you do that through clinical therapy, whether you do that through mindfulness meditation, whether you come into our family recovery center and avail yourself of support groups or other opportunities for support, or a combination thereof. I would really suggest that people look into that, because the National Institute of Health study went on to say that 35% of families that don't receive support go on to experience their own struggles with mental health. Their own substance misuse tends to increase. And we know that a family in recovery is a much more fertile place for the individual to come back into and then celebrate their own recovery. So I think the best single thing you can do to support somebody you love that's struggling is to get support yourself and educate yourself.
Would you like to add to that, Kathryn?
No, I think that was well said and exactly what I would have said.
Well, we've hit the 7:30 mark. So any closing remarks from the two of you?
just a big thank you for taking the time to join us here tonight and talk about this. And yeah, thank you so much.
And I want to thank you, Kathryn. Thank you, AJ, for doing this. And thank you, everybody that attended. And please, I just want to encourage you to reach out to us. 508-488-8105 is our telephone number. You can reach us. You'll get a call back within 48 hours of your call, or come in on a Friday, any Friday between 8:30 and noon. Meet Kathryn, meet myself, meet the rest of the staff, have a cup of coffee. Whether you want to talk about addiction, whether you want some resources, or whether you just want a place to go where you know you're not alone and other people understand. We're here, we're open, and we're waiting for you. And by the way, happy Thanksgiving to everybody.
Yes.
All right. Well, thank you, everyone. Have a wonderful evening.